Okay, so away from all the scrutiny of the news, I enjoyed the session. The thing is, people need to be accountable when we put them into office, right? Another thing is we also have to be accountable for our health, right? So today we're getting into a health conversation, and we should be wrapping up on the sickle cell conversation. We started off to know what it means, what it is, what happens in our blood cells if you have sickle cell, and all of that. And there's actually no need to stigmatize anybody. I mean, it can happen to anybody. You can live with it. People are 70, 75, and they're living with sickle cell. So there's no need coming to make it look like the world has come to an end. Please, yeah. So today we're going to get into management of this sickle cell. And we want to say a big thank you to the Bank Hospital for supporting the morning show. You know what to do if you want to get your health checked. Get to the Bank Hospital at Cantonment near NAFTA. You can check them out, or even on their socials. You can book an appointment and just get that. And also thank you to the Deco Planners for putting up this beautiful Ghanaian decor for the Ghana month, right? Okay, so we have the doctor from the Bank Hospital. Good morning, Dr. Wisdom.
Good morning, the precious one.
Don't do that. Good morning, the wisdom one. Yeah, Charlie. Okay, so I'm excited about the whole Ghana winning thing, but let's get into sickle cell now because Charlie is very important.
Start booking your flights and getting your visas en route.
We're going to US, but we need to also check our sickle cell level because Charlie, the place is too cold. Yeah, right? That's something we need to really check out. So we started to talk about sickle cell and all of that. Let's get into management. Somebody's living with sickle cell.
Yeah.
We hear it's something that is for a lifetime, literally. How do we live with it?
Yeah, so one of the days where people used to think that sickle cell was a death sentence. So once you are, like I said, we should stop calling them sickler, right? So once you are a sickler in quotes, then you're getting ready to die. But that is not the case anymore, because now we've been enlightened, right? And we know that these are the things that could easily cause the acute crisis, and these are the things that could possibly cause a chronic crisis. Not that you would not have these crises, but at least you would limit the crisis. It was just like taking the COVID vaccine, right? The fact that you had taken the vaccine does not preempt you from saying that you will not get the COVID. You could have it, but your symptoms would be much lesser than someone who has not been vaccinated, right? Because you have some level of immunity against the virus. So the same way it applies to sickle cell, the things that you do to ensure that you curtail the crisis. You might have the crisis, but as compared to one who is not aware and taking good care of himself, you might be having, let's say, 2 crises in a year, and then the other person might be having like 6, 7, 8, 9 crises, 10 crises in a year, right? So it's important that we have this discussion to know that these are the things we should avoid and the things not to avoid. And maybe towards the end, just talk about the diagnosis of sickle cell disease before birth, after birth, and then, the counseling. Yeah. So one of the things I would like to talk about, the first thing I'd like to highlight is the medication called hydroxyurea, right? Hydroxyurea. That's why we always say that if you are diagnosed of sickle cell disease, go to the health facility and you'd be given hydroxyurea. And this is because it prevents, frequent crises, prevent you from having frequent crises every year. If you've had more than 3 crises a year, you are a candidate for hydroxyurea.
Is it an over-the-counter medicine?
Nope. It has to be prescribed by a physician, and you can't just go to a pharmacy and get hydroxyurea, right? It's got to be prescribed.
Is it pills or is it an infusion?
It's a pill.
It's a pill.
Yeah.
Okay, great.
Yeah. So so once you get that, one of the things, the mechanism of action is that it prevents frequent crisis, and also it stimulates what we call production of. Remember, I mentioned that the fetal hemoglobin, which is the hemoglobin the baby is born with, is quite potent, it's quite plumpy, tries to, carry and house oxygen and then takes it around the body. So hydroxyurea tries to stimulate the production of that kind of hemoglobin from the bone marrow. Okay. So you'd notice that you'd have reduced S hemoglobin, and then you have more of the F hemoglobin on hydroxyurea, right? And the dose is well calculated based on your weight. And if you're an adult or you're a child, it's calculated based on your weight. Oh. And it's given to you. And sometimes you have to be monitored. So we always say that if you have sickle cell disease, you have to join a sickle cell clinic, because it's like a team of people who, they know you by name. They know you by face. They know you the last time you came. So, instead of having to go to the emergency room with an acute crisis, you're rather walking in to a clinic, have a discussion.
What happens at the clinic?
A whole lot of things. So they actually have a support group, yes, of where you kind of meet together and then discuss issues pertaining to the sickle cell community and share. You have to share medication. They share medication, like tend to know the dates, your review dates. So they give you hydroxyurea, let's say for a month's worth, and then so you're coming back the next month. Sometimes the doctor is even on that page. You want to find out is the doctor available. Maybe you have a question and new symptoms you're having. You just put on the page. The doctor is on the page. So it's a good support group of people, and various facilities have these support group of people. So basically that they follow you up, and if there's any new symptom that you haven't really thought about, or maybe you want counseling for your next pregnancy. So they do all those things, right? Wow. So basically support, And they notice that people in these groups are doing well, quite very, very well, And then people tend to share, their experiences as well. Sometimes a trigger for an acute crisis is stress. And stress...
Yeah, I was coming there.
Stress can be from so many things. Right. It could be from your job, from your relationship, from the fact that you are not financially stable.
You don't have money. Look, if you don't have money, you are sick. You are so sick. Because I was talking about this whole stress thingy. Your employer does not check your sickle cell level to give you a job. So they expect that you're up and running anytime you call. At the end of the day, they pay you.
Exactly.
So if you cannot, so the idea is, okay, if you can't do the job, just take two steps back and we can have somebody who can do it. Probably you're smart enough to do it, but your body cannot contain that much pressure. When somebody's going through all of these, what are some of the basic lifestyle things that they have to do in order to, keep up their work?
Yeah. So first off, you can have that conversation with an occupational health department wherever you work. Okay. They would know how to, maybe schedule times. Now, I've worked with colleagues who have, other conditions, say multiple sclerosis, right? They don't tend to do the night shifts. We work around the clock, so 12 hours, 24 hours. But they tend to do let's say 6 hours, but maybe they'll work more frequently than you who's doing 24 hours and then you have 3 days off. So there's always, it's a human institution. There should be always something to say, okay, because of your peculiar state, these are the number of hours you should work. But maybe you work more frequently than someone who is working round the clock, in this 24-hour economy.
Yeah.
You know what I'm saying?
Right.
Yeah.
I get that. But what if somebody's company does not have these and you want to personally manage yourself?
Yeah.
Some people can't even bring themselves to speak to their bosses about it.
Yeah.
So what do we do?
Yes, some of the basic things that you can do. I mentioned being on that medication.
Yeah.
So if you present to a facility, they'll put you on that. Another thing is avoiding the triggers. You've got to avoid the triggers. One, extremes of temperatures. Right. Like you said, too cold. When you're too cold, the sickle cell, the cells become sickled, and then they tend to clog the vessels. So avoid, if you're feeling cold, get something to wear, jackets, something to wear. If you're too warm all the time, and that could also precipitate for some people as well. So you want to avoid extremes of temperatures. You have to be in between, you see. Another thing is hydration, because dehydration can precipitate crisis, right? Dehydration, let's say that you haven't had water. Someone can go a whole day without even drinking a cup of water, a glass of water, and that's very bad, because now you are starving the cells. Now they can't even move freely. They tend to get clogged in the smaller vessels and then cause the symptoms that we mentioned the previous weeks, right? So you always want to take some water, at least 3 to 4 liters a day, especially for sickle cell disease, at least 3 to 4 liters a day. You want to always constantly hydrate yourself to keep that running, right? And I also mentioned the last time that because of the peculiar states of the sickle cell disease, prone to certain infections, especially encapsulated bacteria, you'd have to be, they put some people on prophylactic antibiotics.
Okay.
Right. And that, again, your physician is the only one authorized to put you on that based on his clinical findings. Right. Put you on prophylactic antibiotics and then have to be vaccinated. Get a pneumococcal vaccine, get a vaccine against meningitis, because you don't want to have these infections, right? And that's what lead me to my next point, infections. So infections do precipitate crisis. So you want to avoid infections as much as possible. You want to, try to, what you can do, frequently wash your hands, just don't interact with things that could cause you to be infected, right? And then again, if you think that you've gotten an infection, quickly go to the hospital for management. Don't wait till it becomes worse. Some people have a cold, have a chest pain, they can manage it through the day. They just want to, manage. Yeah. Don't do that. Go to the hospital before it's too late, right? So those are the few things that you can do. I already mentioned stress. Try to avoid stress, and you have to intentionally de-stress, right?
Find time to rest.
Find time to rest.
Right.
If it means sleeping some number of hours, please do. If it means going to the beach, not the Galamsey beach. Very pure.
Yeah, very nice place.
Right, yeah.
Oh,
so if it means going to a spot where, you can just be at the beach, but you're just listening to the sound waves, there's silence and noise, right? So just anything that could help you de-stress. Is it deep breathing?
Listen to good music.
Exactly.
Right?
Is it going for massage? Is it going out with your loved one? Anything that could, help you forget the stress of life. That is what you want to engage in.
I see. Now, let's talk about women who are pregnant.
Okay.
And probably they didn't even know that they were sickle cell, all of that. Then they found out maybe at antenatal or something like that. Okay, you have sickle cell. Walk us through managing these kinds of patients, till they deliver, during pregnancy and all of that.
Yeah. So you don't know you've been diagnosed with sickle cell disease till you are pregnant. Now, you should know this even before you get married. Right, before we get to pregnancy. So as part of the spectrum of testing for sickle cell disease is genetic counseling. Because that's where it starts from, genetic counseling. If I know I'm AS and my partner to be is also AS, you'll be counseled that these are the risks, these are the possibilities. Do you still want to do it? If you still want to do it, you should be well informed that this can happen. You can get a 25% chance that you can get a sickle cell disease child. Now, when you get pregnant in that state and you are testing at the hospital, knowing for the first time, it's an error because you should have known before you got married, now before you got pregnant, because it helps you even plan your pregnancy. There's a myth that those who have sickle cell disease are not able to get pregnant. No, that's a lie. I've seen at the ONG department when I was at Cape Coast, quite a number of sickle cell disease women who have, given birth. But you need strict monitoring, very extremely tight, strict monitoring because, like I mentioned, some of the crises, your blood levels, and this blood levels is needed for the placenta, for the baby to grow. So you need to monitor these things frequently. And for some of them, at a particular point in their pregnancy, they need to be in the hospital till delivery. Right, for some of them, those who tend to have, crisis whilst they are pregnant, sometimes it could also come with other pregnancy complications. Pregnancy in itself comes with its complications.
Right.
You want to measure with sickle cell disease. So it's a bit tough to manage at home. So you need to be in close contact with your primary health physician, right? So that monitoring is always there. The slightest symptoms you have, you voice it out, and then they know what to do, So it's possible that you can get pregnant. But then again, I always say that genetic counseling. Now, if you miss that step, now you now come to where you can now, for some people and more part of the world, they can do what we call chorionic villi sampling, and then to test that, the baby could have, this sickle gene. And
in that case, do they terminate the baby?
So, well, in Ghana, termination of pregnancy is against the law, except in certain conditions that have been prescribed, right, by the law. Yes.
Wow.
It's against the law, except in certain conditions, right? So, yeah, and then also for physicians who, because of personal religious reasons, are not able to terminate, are free to refer to, other people who can or will be able to do that, right? And then again, we always say that if it has to be done, it has to be done right. Like I said, if it poses a risk to the mother, significant risk to the mother or the child, then there's always, it's always a clause.
Give me a clear situation. So there's a sickle cell mother. Has maybe she's pregnant and she's going through acute crisis. And what would be the worst situation that the mother would be going through that would affect the baby that much that they have to probably take that out?
Yeah, so like I mentioned, it's the complication of the sickle cell. So you can be pregnant, but you are in severe pain, severe joint pain. It would not necessarily affect the baby, but it's affecting you, and you are carrying an extra being, right? So that is even more stressor to you. So already you are having a pain crisis, and now you are being stressed mentally. So these people also need psychological counseling, as well, because you need to cope. Why are you carrying a baby that is already stressful for 9 months? And you're also being stressed with pain, right? And the reason I say you have to be strictly monitored is because now you are prone. Pregnancy tends to reduce your immunity. Now you are prone to infection. So we need to know that you are not getting any infection from anywhere at all, right? We also need to know that you are not going to suffer any of the complications. I mentioned that stroke is one of the complications of sickle cell in young people, right? So you don't want to have that as well. So they need to strictly advise you, do this, don't do this, do this, don't do this. You need to be on your medications as prescribed, the folic acid, and all that. So you have to be within the confines of, the health zone so that you know that there's nothing wrong, there's nothing that you're not missing out on anything, really, because it's tough. Honestly, trust me, I've seen women go through this, and it's difficult if you don't have support, especially from your partner. If your partner is not very supportive, you realize that, people tend not to do well because you're not only going through pain crisis, you're going through pregnancy. You're not only going through pregnancy, now you're going through mental stress because now you don't even have support. One thing we pride ourselves in Africa is the fact that we have support, family support,
right.
Relative support, as compared to outside world where it's you and your God and perhaps your nuclear family, right? So support we can't overemphasize the role of support when it comes to, chronic diseases in general, especially sickle cell disease.
Wow.
Yeah.
That's huge. So this is why you need this education. So before you get married, I know you're in love with him and it's okay. I mean, he's your lovey-dovey, but you can build your world around something that will eventually crash.
Yeah.
Crash over pain, right? So let's do this right. Let's get to the hospital. Let's find our sickle cell status. Let's know if we're compatible, health-wise, so that, it's not like love going down the drain. Yeah, but I'm really concerned about. So, is there a situation where they can take the fetus out and nurture the fetus differently and keep the mother? You can have both alive at the end of the day.
So you mean outside of the womb?
Yes.
So
outside of the body, literally.
Outside of the body. So in Ghana, I would not be able to do that if I'm understanding your question very well. Because if you are looking out for treatment of sickle cell, right? Like I mentioned, hydroxyurea, that helps to manage it, right? Now there's cell transplants, right? And that is done for those who are 16 years and below, right? That has been the proven cure of sickle cell, like bone marrow transplants, right? And that is very expensive, and not everybody can afford that. So when you say housing the baby outside of the womb, what stage are you looking at?
Maybe let's say, second trimester, you're unable to carry the fetus till...
Oh, no, that's not possible.
It's not possible?
Nah, that's not possible. At what point would they now... Do you get my point?
Yeah.
Yeah, but I mean, I think specialized research can, for those who want to opt for IVF, specialized research should be able to identify, the abnormalities in a particular, let's say the sperm, and then knowing that, okay, this female is this, and know that, okay, when we add this together, this is a possibility. Specialized research, I think we should do more research. In Ghana, we don't do lots of research to this area. We just depend on whatever is done in the outside world. I think that is a call to action if we are to, do more research. Like the way we got to find out that 2AS, getting married, there's a 25% chance. I think that we could advance research to find out that what are the other ways of, preventing it? What are the other ways for those who are already caught up in this, circle? What are the other ways to help them out? But then again, whilst we are still researching the other ways, let's start from the drawing board.
The basics, yeah.
Let's avoid it in the first place, right? Avoid it in the first place. We don't have to deal with the stress. Because sometimes you can have all the, butterflies and all that, because it's just for the moment. And then when you realize that it starts happening, I've seen a few years ago, I've seen patients who now their couple is, they're not happy with each other. Whenever they come, they're always quarreling. This one said it's you, this one said it's you. Then I thought to myself, years ago, before you got married, wasn't it exactly? So now who's at fault? Because we cannot know, we can't tell, we're not there. Perhaps it's one of them who still pushed for it. That, oh, don't worry, we can do this. Exactly.
I'll be with you the whole
now
time.
They are blaming. It's a blame game. You can't tell, so you just have to, leave them to it. So I think that I should go back to the drawing board. A colleague made mention that in Africa, we are very stubborn.
That's very true. Mean, we have God, we're spiritual.
Yeah.
Nothing that, we can...
She said we are very stubborn in Africa, that if we're to be the whites, like by now, they would have eradicated, but we're very stubborn. We say A plus B is C. Don't touch that iron. That iron is hot.
That's exactly
and that is when you want
to
pick up the iron and place it on your ear like a phone call. It will burn you to the skin. So you see... So I think that we should be very careful, and we should try as much as possible. In as much as, we are trying to prevent it, there are other people who are caught up in it.
Right.
What can you do? They have no
destiny,
say. They have no say. They didn't bargain for this.
Oh, no.
Because perhaps the mistakes of their parents, but they are in it already. So do we neglect them?
No.
That's why we need support groups. Anyway. Please always find support groups. They are available. People survive. That myth that people don't, please, I want everybody to take it out of their mind. You can have sickle cell and survive. I don't know what, people should take that out of their mind. Take good care of yourself and then you'll be fine.
Well, you heard the good doctor, take good care of yourself, but let's have the hard conversations, even in the midst of love. Yeah. Let's have the hard conversations. If you're not compatible, no need going there, because that child that's coming with a great future might be terrified with some health issues. You want to do things right. Thank you to the Bank Hospital for supporting us. Let's go for a break. Then when we get back, we'll have some sports combo.